Ladies and gentlemen, thank you for standing by, and welcome to the Public Health Law and Policy Smoke-Free Parks webinar. During the presentation, all participants will be in a listen-only mode. If you would like to ask a question during the presentation, please use the chat feature located in the lower left corner of your screen. And if you need to reach an operator at any time, please press *0. As a reminder, this conference is being recorded Friday, May 4th, 2012. And I would now like to turn the conference over to Charlene Primus. Please go ahead.
Good morning. This is Charlene Primus, and I'm the Assistant Director of Tobacco Prevention and Control at the Cook County Department of Public Health. The Tobacco Prevention and Control Unit is dedicated to reducing the burden of tobacco within suburban Cook County. And as a part of this effort, we are hosting a series of webinars on cessation and smoke-free policy. I would like to thank Public Health Law and Policy for putting together our first webinar this year, and thank our funder, the Illinois Department of Public Health, for making this webinar possible. All right, I would like to turn it over.
Great. Thank you so much, Charlene. I would also like to welcome everyone to today's webinar on creating smoke-free parks, exploring policy options and sharing practical tips. As you heard from Charlene, today's webinar is being co-sponsored by the Cook County Department of Public Health. My name is Leslie Zellers. I'm the Director of Programs at Public Health Law and Policy, and I'll be facilitating today's webinar. Let me tell you a little bit about Public Health Law and Policy. We're a nonprofit organization that helps communities pass laws to make the healthy choice the easy choice. In the area of tobacco control, we've helped dozens of communities limit exposure to secondhand smoke or require a license to sell tobacco products. You may also know us from our work on policies to help communities increase options for healthy eating and active living, such as banning new fast food restaurants in a particular zone or opening up school grounds for the community to use after school hours. Because we're lawyers, we also have a little bit of fine print, and so we're just letting you know that we're not providing any legal advice on today's call. We're just providing you with information that we hope will be helpful to you in your campaign. So let's talk about the agenda for today's webinar. We'll be learning about how to create smoke-free recreational areas. And I'm using the term recreational areas broadly, so it includes not just parks, but also other types of places where people play or exercise. Today, first we're going to hear about the importance of smoke-free recreational areas, and then we'll learn about how to adopt a law or a policy to create smoke-free recreational areas. Then we'll go on to what are the components of a law or policy on smoke-free recreational areas, and also a very important step, how to get a campaign to generate support for your smoke-free recreational policy. Finally, we're going to hear from one community in California about their experience working with a number of cities to create smoke-free parks. If you have any questions, as we heard from the ReadyTalk operator, please type them into the chat box, which should appear at the lower left of your screen. Your phone is muted, so you won't be able to ask any questions by phone. But we do encourage questions at any time throughout the webinar. I'll be keeping track of them, and then we'll answer them toward the end of the webinar. Next, let me tell you a little bit about our speakers. Our first speaker today is Robin Salzberg. She's a consulting attorney with Public Health Law and Policy, specializing in current and emerging legal issues involving exposure to secondhand smoke. During the last 7 years, Robin has developed model ordinances, written fact sheets, offered trainings, and provided one-on-one technical assistance to public health advocates to successfully advance the goal of reducing exposure to drifting secondhand smoke. Our second speaker is Nicole Cox, who's the Tobacco Prevention Policy Lead for the Public Health Department Tobacco Prevention and Education Program in Santa Clara County, California. Nicole started with the program in 1999 as the staff coordinator for the Youth Coalition, and most recently led a number of policy campaigns for the Santa Clara County's Communities Putting Prevention to Work CPPW grant. Nicole's experience in the tobacco control world has included working with youth and young adults on advocacy projects, maintaining active coalitions, collaborating with city and enforcement officials on both adoption of new policies as well as compliance and enforcement of existing policies, engaging the community around policy campaign organizing, and also evaluating the impacts of policy interventions. So with that, I'm going to turn it over to Robin Salzberg to get us started.
Thank you so much, Leslie, and good morning, everybody. So to warm up the chat box to make sure that we are all familiar with how that works, what I'd like you to do is to answer this question that you see on your screen. What type of recreational area would you like to make smoke-free? So please type your answer into the chat box. You'll see that on the lower left-hand corner of your screen. And one thing to note, that when you type in your message, I will be able to see it, all the presenters will be able to see it, but the other attendees won't be able to see it. So I'll summarize what's coming in through the chat box. So if you want to type your message here and click on Send, we'll see what comes through. And if you have any questions, you can always contact the operator for assistance. So it looks like I'm getting, I haven't gotten any responses yet. Oh, there we go. So someone has typed in picnic areas and playgrounds and parks and beaches. Excellent. So it seems like folks are familiar with how to use the chat box. That's great. So many of us are familiar with why we want indoor places to be, oh sorry, my slides are advancing a little slowly here. Why we want indoor places to be smoke-free. The U.S. Surgeon General has concluded that there is no risk-free level of exposure to secondhand smoke indoors, and it's a serious health hazard. It causes disease and death. But what about in outdoor places? When we're talking about recreational areas, we're talking about outdoor places. So is secondhand smoke and smoking a problem? Well, the researchers are finding that yes, indeed, secondhand smoke exposure is unhealthy even in outdoor locations. They have found that secondhand smoke levels in outdoor places can be equal to the amount found inside if smoking is allowed. And irritation can start at very, very low levels, 4 micrograms per cubic meter. And in some situations, depending on where the smoker is located, that can be found as far away as 13 feet. So you think, okay, if I'm close to someone who's smoking, maybe that's not so good. But it looks like you need to be as far away as 13 feet before you're not going to be affected by it. And in fact, they've started to measure how far away do you need to be. And in some cases, someone would need to move 25 feet away from the person who's smoking. And just to give you a sense of how far that is, that's being across the street on a 2-lane road. So if the person who's smoking is on one side, you would need to be on the sidewalk on the other side of the street to avoid any sort of impact. Another problem with smoking is the litter of the cigarette butts. And I just found this statistic staggering. Americans discard more than 175 million pounds of cigarette butts every year. It's the most common form of litter in the United States. And even though the outside wrapping is made of paper, the white stuff that looks like cotton is actually plastic in the cigarette butt. And that can take up to 15 years to decompose. Cigarette butts also find their ways into our storm drains and our waterways, our rivers, lakes, and onto beaches. And again, it's a significant source of litter. And another reason to have smoke-free recreational areas, many communities are trying to encourage people to lead more physically active lifestyles. Get more exercise, walk more, bike more, run more, play more outside. And if there is secondhand smoke, it defeats the whole concept of having a healthy recreational area. I was training for a walk, and we were walking 60 miles. And as I was training for my walk, it was the worst thing to be walking behind somebody who was smoking, because here I was trying to be healthy and get in good shape, and it just felt awful. The other thing is that we want to be modeling good, healthy behavior for our children. And having smoke-free areas be the norm is really important for helping children to understand that a healthy lifestyle does not include smoking. So by passing a law or adopting a policy to create recreational areas that are smoke-free really helps to alleviate health risks, promote healthy living, and to reduce litter. So how would you go about adopting a smoke-free parks law? Well, there are several entities that could adopt a smoke-free policy or law. And I'm going to go through those. My slides will advance. Oops. There we go. So I'm going to start at the largest and go down to the smallest legal entity or government entity that could adopt a smoke-free parks policy. So the state legislature could adopt a law making all recreational areas smoke-free, or they could select a certain type of recreational area to be smoke-free. Or they could pass a law to make just their state-owned parks smoke-free. And let me give you an example of what I mean. So in California, the state legislature adopted a law to make tot lots and children play areas of all city, county, and state parks smoke-free. So if there's a park and it has a children's play area, which is defined as having a play structure, swings and slides, that sort of thing, you're not allowed to smoke there or within 25 feet of it. But other places in the park, you're still allowed to smoke. Another way a state could adopt a policy is for the Parks Department or agency to adopt a rule or regulation about smoking in state-owned parks. And this is what New York State has done. The Office of Parks, Recreation, and Historic Preservation is going to designate smoke-free areas around all the playgrounds and swimming pools in state-owned parks. They're also going to designate in certain parks smoke-free areas around the picnic areas, the outdoor dining places where food is being sold, and around swimming beaches. Now, this is a rule or regulation that the agency, the Parks, Office of Parks, is adopting. Another way that a smoke-free parks law or policy could be adopted is at the city or county level. And at this level, the elected officials, the city council or the board of supervisors, could adopt a local law or ordinance to make all the recreational areas in that city or county smoke-free. Or again, they could just say, we want the city or county-owned facilities to be smoke-free. And in Illinois, over 20 communities have adopted smoke-free parks laws. The last government entity I want to discuss is called a park district. And in Illinois, you have many of these. And these are special government entities. They were created for a very specific function, and that is to maintain and operate the parks. And these parks or recreational facilities can be in many different cities, but they're all overseen by this one park district. And the park district then can adopt its own policy about these properties to make them smoke-free. Now, they can only adopt a law or policy about their own properties. So even though the park district might have property in, I'm just going to make up a city, the City of Progress, they can't make all the City of Progress's recreational facilities smoke-free. They can only adopt a policy about the park district property. So why can these government entities adopt these sorts of policies? Well, the legal phrase is that they have police power. And when you think police power, you think of a police officer. But this is a legal concept, police power. And what it means is that an entity, a government entity, has the power to adopt local laws or policies to protect the health, welfare, and safety of residents. And so I want to give you a couple of examples to help clarify this concept. So a speed limit, that's adopted to protect the safety of drivers and others that are using the roads, bicyclists, pedestrians. Seatbelt laws, car seat laws, bicycle and motorcycle helmet laws, these were all adopted to protect the health and safety of residents. Litter laws, or picking up after your dog laws, those are also for health and safety reasons. So because secondhand smoke is a known carcinogen, it's unhealthy, and so governments can adopt laws to protect residents' health by creating smoke-free places, both indoors and outdoors. And this is under the police power legal authority. So now that we know about who can adopt a smoke-free recreational area policy or law, what would you want to have in those types of laws to make sure that they are clear and strong and protect public health? Well, the first component is, what do you want to do? I've been using the phrase smoke-free and no smoking or non-smoking, but you could also make a tobacco-free policy, and that would be to restrict the use of any tobacco product, so smoking or smokeless like chew. Now, in some communities, rural communities where smokeless is very prevalent, or in locations where smokeless use is prevalent, like in a softball field or baseball field where the participants tend to use it, you might want to consider a tobacco-free policy, not just a smoke-free policy. The next component is, where do you want to make smoke-free or tobacco-free? Now, parks is a clear one, playgrounds, picnic areas, but what about swimming pools? What about sports fields or baseball diamonds, recreational trails, bike paths, golf courses? These are all possible places to make smoke-free or tobacco-free. The other thing you want to think about is, what about adjacent areas to the park or the playground or the swimming pool? So what I mean by adjacent areas is, what about the parking lot? Are people going to be able to smoke in the parking lot and then go into the park and that's smoke-free? Or do you want the parking lot also to be smoke-free? What about adjacent sidewalks or pathways? Will those also be included? Now, we strongly recommend, for public health reasons, to make the entire area non-smoking. But sometimes, if there's a very, very large park, you might want to designate smoking allowed areas. And if you do this, you want to be very clear about where the smoking allowed areas will be located, how many, what can it be next to, what sort of signage is required. You want to have a specific set of criteria to define the smoking allowed area so that it's clear for people where smoking is allowed and where it's not allowed. One question we get very frequently is, but how do we enforce a smoke-free or tobacco-free policy. Now, the good news is that for the most part, these sorts of policies or laws are self-enforcing. And that means that the public who know about the law will let somebody who know who's smoking that, hey, this is a smoke-free park and smoking is not allowed here. But you also want to have a more formal way of enforcing a smoke-free or tobacco-free policy. And as you develop your policy, you want to work with law enforcement, the department that might be enforcing the policy. It could be the Parks Department. It could be other people who are involved with the parks or the recreational facility, to talk with them about who is going to be in charge of enforcing the policy if there's a complaint. And enforcing can range from walking up to somebody and giving them a warning, hey, did you know this is a smoke-free area, you're not allowed to smoke here, to writing them a citation or ticket, kind of like a traffic ticket, even up to arresting them for violating the law. So when you work with your park district, your city or county, they probably already have a protocol of how they enforce laws in the parks. Perhaps there's a no alcohol law. How would they enforce that? And translating that into and using that for your smoke-free parks or recreational area policy is a good way to go. Also, there may be a set of penalties, a range of penalties that can be incurred. Those also are probably set by your city or county or park district. They may already have those, so you could use that for your smoke-free policy. The other piece that I want to talk about are some other options for your smoke-free or tobacco-free policy. And that is, one is signage. And it's very important to post signs because that helps to educate people, to inform them about the law or policy. And it also helps with that self-enforcing piece. Somebody can point to a sign and say, hey, see the sign there? It says this is a tobacco-free zone or a smoke-free zone, and you're not supposed to smoke here. The other issue that people ask about is, what about ash cans or ashtrays? Should we have those in smoke-free places? And communities go different ways on that, but I wanted to just bring this up, is that some communities say we don't want to have any ash cans at all. It sends the wrong message. It looks like you can smoke here if you have them, and so we don't want to have them in our smoke-free areas. Other communities like to have an ash can right at the entrance, if that is a feasible place to have an ash can, right at the entrance to the recreational area, to give a signal that here is the last place for you to put out your cigarette so that there's not litter and that this is the appropriate place to put it. So I've gone through several different issues that you might want to think about for your smoke-free parks or recreational areas policy. And I want you to know that we do have what we call a checklist. And it goes through these different options which you can then use as a way to discuss what policy options you want to have with your coalition, with your partners, with your elected officials, so that you can figure out what's best for your community. And I don't think that this was mentioned earlier, but this webinar is being recorded, and the recording, the PowerPoint slides, this checklist, as well as other resources will be posted on a web page, which we will be sending out the address to you, so that you can access these materials as you work on your policy. You can download them for free, and you'll have all of these resources. So I'd like to turn it over now to Nicole, and she's going to share with you Santa Clara County's experiences in smoke-free recreational areas and how they were able to partner and build their campaigns to create smoke-free places. So Nicole, I'm going to turn it over to you.
Hi, great. Thank you, Robin. And thank you everyone for having me on the call today. I'm very happy to be here to share a little bit about our experience here in Santa Clara County. So kind of to begin, I just want to lay a little groundwork of where we were in terms of smoke-free parks prior to the last 2 years of our Communities Putting Prevention to Work grant. So before we started our grant, we only had one jurisdiction in our county that had a smoke-free parks policy, and that was our city of San Jose, which luckily is our largest city in our county. So across the state, many communities have been working to adopt smoke-free outdoor policies, smoke-free parks policies, smoke-free recreation areas policies. And in our county, we had some momentum that had been building prior to our CPPW grant with work through local community-based organizations, but there hadn't been a lot of success. So it kind of all culminated around us receiving this CPPW grant as a way to expand our work and try to promote this out further to our cities. So the CPPW grant really allowed us to expand our work, engage a lot of new partners, and then one of our core strategies was a whole combined process of sharing our resources with the cities and doing a whole community engagement, a campaign building, which was something fairly new to us. So I'm going to talk a little bit about that now. It looks like my slide got a little cut off there, but basically we're trying to build upon our success. We had our largest city with a smoke-free parks policy, and at the culmination of us getting the CPPW grant, we had a very strong champion on our Board of Supervisors who was kicking off his year of presidency and really wanted to make tobacco control one of his top priorities. So we had the luck of new funding and a very strong champion to kind of kick off our county initiative. And in the fall of 2010, we adopted a set of comprehensive tobacco-free tobacco prevention ordinances, including a smoke-free parks policy, trails in all of our county park land. So that was very exciting. And as I mentioned, as part of our sharing of this new grant funds that came in, we wanted to create a sense of collaboration between both the city and the county and also the community. So we did a two-pronged approach of offering resources, funding directly to cities that would go towards developing a policy, researching a policy, and then hopefully if a policy is adopted, funding that could actually go to implement the policy. So that was one of our major approaches, and I'll talk a little bit about how that came about. And then the other approach that we wanted to kind of tag team on was a whole process of community engagement, because just because the city might be receiving funding doesn't necessarily mean that the city council and the decision makers are going to be on board, and they want to ensure that the residents are behind this and the stakeholders have been engaged. So we kind of saw it as a two-process approach. So I'll talk a little bit about that and highlight some of the specific strategies that we used. And I'm going to start with the model that we used with our campaign organizing, which we borrowed from our friends at the Center for Tobacco Policy and Organizing and the Los Angeles County Department of Public Health, who created this model as out of a need for how to do tobacco policy work, although this is a method that can be used for a number of public health policy campaigns. And I believe that Public Health Law and Policy will have a link posted for a lot of the resources tied to the model, because I'm going to go through them pretty quickly, but so you can get more information there. So to start off, I'm going to go through each of the campaign phases. It's a 5-phase model, and the first 2 phases are fairly similar. The first phase is the community assessment phase, which is kind of looking at where you are at baseline. What does your data show in your community? Is there still things that you need to look at, to examine? Do you need to have some further conversations? A lot of this for us started with We had an existing tobacco-free coalition, so they had a number of great insights into what is the best city to start with, where are their resources, is there momentum in some areas and not for others, and of course, where's the greatest impact going to be felt. So we looked at that. We, as part of the CPPW grant, we had this new leadership team who were a lot of key players in our community, and so through that and the conversations with them, and also we had been doing some key informant interviews with other city officials and elected officials from our previous work through our state grant, and found that although in many of our cities there was a lot of support for smoke-free policies, there's just so many competing priorities, and the staff did not have a lot of time to work on it. So although there was support, there was this resource issue and prioritization issue. So our leadership team saw it as a core strategy of the idea of giving resources and through funding to the cities so that it enables them to prioritize this issue that they care about. So that was kind of what we found in our assessment and why we decided to do the two-prong approach. And that led into our strategy planning, and this is kind of where you work to develop your core strategy. You've identified your key cities that city or county that you want to work with and try to create the policy change. And the method that we use is the Midwestern Academy strategy chart, which you are identifying your goals, you're looking at your resources, do you have space for your campaign, do you have funding, all those sorts of considerations that you need to look at when you're building your campaign. And then really diving into, who are our supporters, who cares about this issue, who's influential in our community, who's going to influence those decision makers in the cities that we're trying to get this policy change in, and then what are the core tactics that we're going to use to influence that decision maker. So in our case in Santa Clara County, we had 12 of our 15 jurisdictions that went in for this funding opportunity through CPPW, and all 12 of them chose to work on a smoke-free initiative. And all of them, I believe, except for the city of San Jose, who already had a smoke-free parks policy, chose to do something around smoke-free outdoor areas, including parks and recreation areas. So we knew that that was something that we wanted to work on and prioritize in our campaign. So I'm going to move along to the next phase. And the next phase, which a lot of the times people will want to skip over if they have existing stakeholders and a coalition of supporters and just kind of work with what you got. But the recruitment phase is really, really key. And we spent a lot of time being very strategic about our recruitment and going back and forth, and it's kind of something you do throughout your campaign is recruit and recruit and recruit. And one of the tools that we use that was developed by the Center for Tobacco Policy and Organizing, and it's also part of your strategy planning, is a tool called the Decision Maker Matrix, where you actually plug in each of the council members or the supervisors or whoever the decision makers are in the city where you're trying to enact the policy, and kind of go through each of them to find out where do you think they are on this issue. In our case, a lot of the times it was we don't know. So starting by looking at on the website, checking out their bios, doing a little research on each of those decision makers to find out, do they have children? Have they voted on in support of public health policies in the past? Are they involved in any key committees or other organizations in the community? And so we would use this for our recruitment to say, if we had a council member who was maybe on the Parks and Recreation Commission, well, maybe that's a potential champion for our policy, and maybe we want to look towards recruiting people who are going to influence her in that way, or maybe a council member is involved in a church in the community, and maybe you want to work towards recruiting people who are part of the church, or so different tactics like that. In our case, we knew that youth were really going to be influential in promoting a parks policy, and we had a very active youth coalition. So we worked with our youth coalition to reach out to some of the high schools and did a lot of recruitment that way. And then when we would go and do our meetings with the decision makers, the youth were there and presenting a lot of the information and reasons behind why they feel this is a really important policy. So I'll talk a little bit about recruitment too strategically and give you a couple of examples when I get to the next part of our campaign strategy. So phase 4 of the campaign essentially is implementing your campaign that you designed, putting all those tactics into place to get that policy passed. And so I'm going to just kind of give you some examples of what we've done with some of our cities here in Santa Clara County. And so I mentioned that youth were a big part of our campaigns, and one of the things we started off kind of as a way to both recruit and just get youth doing something active in their community is we did a lot of litter cleanups in the parks of the campaigns that we were working in each of our cities. And this was a great way to recruit people. We recruited a lot of youth. We got a lot of different organizations involved, random people who were at the park and just saw what we were doing and got involved. And so it was a very good way to have a multiple approach to the campaign where we were accomplishing a lot of things all at once. And another really important thing we accomplished by doing that was collecting data on the litter that we were seeing in the parks. You can see a picture here. The youth created this as they were counting all of their cigarette butt litter, and they did a really neat diagram that they photographed and presented this information in photograph form, and brought bags of cigarette butts to meetings with decision makers or when they were providing public testimony. And it's a really nice visual of how much smoking is occurring in the park and how much litter is produced. And you can see, they collected some of the Swisher sweet wrappers and to just show that this is a real issue in the park. And one of the really cool things that the Youth Coalition did with that is they went to parks in San Jose, which has a smoke-free parks policy, and it had been passed several years back, so it was been implemented over several years, and did a comparison of the findings and presented that. And what they found was in the city of San Jose, where there was a smoke-free parks policy, there was way less tobacco litter. You can see here there was almost 2,000 cigarette butts in this one park where it was picked up in an hour, and in the city of San Jose it was under 100 or about 100 cigarette butts. And so it really shows that this policy does make an impact, and that was really influential to the decision makers in hearing that youth are engaged and care about this issue. And then some of the other tactics that you can think about, we did endorsement forms in many of our cities, and that was another great way to recruit people. It's a good way for people to kind of be involved who may not have a lot of time but are supportive of the issue, that they can sign on and say, yes, we support having smoke-free parks in our city. And we were able to present these to the decision makers prior to the policy getting adopted, and then we'd bring the big stack to the city council meeting, and it was very influential. And in the city of Campbell, which is the example you see there, one of our core decision makers we needed to win over was won over by seeing all the endorsement forms because he knew that his residents were really behind this. And then, of course, through media advocacy is another really important tactic. The op-ed you see here was written by one of our active Youth Coalition members, and she's actually a part of a youth advisory commission for the city, of which she was working to pass the policy. And so we were kind of stuck in this one city here where the committee that the policy was under was not doing anything for several months. They would have meetings about it and no action would happen. They wouldn't pass it on to the full council. And so prior to a key committee meeting, we had our youth coalition member and another resident who was part of our campaign write an op-ed to the local paper and say, we've been working on this issue for several months. We're really hoping that this committee will move forward. This is a very important issue that we care about. And so at that meeting, the committee said, we've been talking about this a lot. Let's just move it on to the city council. We're supportive. This is, a great ordinance, and we support this. And so it was really influential. And then I just want to mention that the top photo with the shirts was something that we borrowed from our friends in Los Angeles County at many committee meetings and council meetings, you may not have every person in attendance speak, but if there's some sort of identifying factor, like a t-shirt like you see here, that shows the decision makers that there's a lot of people out there that support it. And this isn't something that's been used by labor unions and a lot of other groups to kind of show that solidarity, and then they kind of recognize you when they see you at different events when you're wearing the t-shirt, and they say, hey, I know you. You're those SmokeFree Parks people. So that was something that we found really effective. And there's many other tactics that you may choose to use. I don't have all of them here with me, but I think another key thing is meeting with the decision makers, sitting down, finding out where they are in the issue. So check out the center, and they have a lot of great lists of tactics that you might want to consider. So then I'm going to move on to phase 5 of the campaign, which is very important, as Robin talked about. Once you have a policy adopted, then you have to make sure that it is implemented and enforced and evaluate how your policy is working. So of course it hasn't been that long since many of these policies have been passed. So we haven't necessarily evaluated them all yet, but that is what we're going to be doing over the next several months. But one of the first things we wanted to do with the cities that had adopted policies was recognize them, thank them for their support. You can see here is a picture of our campaign team awarding the mayor of the city that adopted the policy. And this is just a great way to say thank you so much for doing this work. And it's also a subtle way to say we'll be back, and hopefully we can count on your support for tobacco prevention work in the future. So we did that in each of the cities where policies were enacted. And then we also worked with many of our cities to support them in developing any educational materials here. You can see we have some materials from the city of Mountain View. They developed a brochure about their new parks, smoke-free outdoor policy, a postcard. Many of our cities that adopted parks, smoke-free parks and recreation areas policies also created these little business-sized cards where they could just go out into the parks and kind of hand them out if someone's smoking, or just to anyone out there, and just educate them that there's a new parks policy in the city. And it was kind of a friendly way of doing enforcement rather than a citation. So that would occur over the few months after the policy was adopted. And then in one of our cities, we were actually able to support them in putting up billboards that just kind of celebrate and promote the fact that they have these great, healthy environments that are smoke-free, and to enjoy them and be active and healthy in the parks as they're out there. So. And of course, signage is something very important as well, that we worked with all of our cities on, making sure that they had signage that was clear and posted. So that is the end of my presentation, and if there are any questions, I'd be glad to answer them. Thank you so much.
Great. This is Leslie welcoming you back. Thank you so much to both of our speakers, Nicole Cox and Robin Salzberg. That was a lot of really great information. And I think it addressed a number of the questions that were submitted to us prior to the webinar. But again, if anyone has any particular questions that they want to ask now based on the presentation, please go ahead and enter those in the chat box, and we'll address them now. And I wanted to follow up on a couple points of Nicole's presentation. One of the questions that we got from attendees is kind of, what's your first step? How do you start a smoke-free policy? And I really like the framework that you set out about these different 5 phases from the Center for Tobacco Policy and Organizing. Would you say that the community assessment stage is the first step, or what would you say to people who are just kind of first grappling with this issue?
I would say for us it really helped to do the community assessment to start off. It kind of lets us know, what policies are already out there, where has there already been success, is there momentum in one of our cities where there might be a strong champion for tobacco control issues. And it also is a great way to kind of have those informal conversations with people, and you can kind of collect allies and recruit that way. And so I mean, we found that to work really well.
Yeah, and it's interesting. I mean, it seems like there are a couple themes that emerged. Definitely having a champion was really important, and also having the engagement of the community. It sounds like youth were a really effective component of that, which we've definitely heard from other places that policymakers really notice when youth are in the room. Was that your experience?
Yeah, we did notice that a lot in many of the council meetings when they would see us several times, and they knew that they were always surprised if the youth were there without their big jars of cigarette butts, and it was very effective to have youth be very involved in this.
And then this is a question for both Nicole and Robin. Nicole, in particular, it sounds like you had a lot of success in these particular cities in Santa Clara County. What, if anything, did you find were challenges, or were there opponents that spoke in opposition, and what did you do to counter that? And I know Robin also has experience working with a number of communities too, so if you have any thoughts on that.
For us in Santa Clara, we did have a couple of cities where there was opposition, not as much for some of the other policy work we do, but in some cases I know in the county when we passed our policy, because there are so many large county parks, there was a lot of issues around employees having a place to smoke on their breaks. And so there was a lot of debate back and forth whether there would be a provision, they would create a designated area or not. It ended up they still went 100% smoke-free, but it was definitely controversial. And then in one of our cities, the common arguments we hear when they want to create designated areas is, there should be a place for someone who's a smoker and also wants to be outside at a park. So we've definitely seen that debate, and so.
And this is Robin, and adding on to that, because indoor smoke-free laws are very common and accepted here in California, there is a little unfamiliarity or uncomfortableness with, well, do we really need to make the outdoor areas smoke-free? And so having this new research and evidence to show the harm of outdoor secondhand smoke exposure, that seems to be very persuasive for people. And also the litter issue is key. So, I love that poster, Nicole, that you showed with all the cigarette butts, and that's a great comparison of a place that has a smoke-free policy compared to a place that doesn't, and the amount of litter. So that's very persuasive for people. If they're not exactly sold on the health reasons, then the litter reasons get them. And then the other thing that we found is that actually the police are supportive of smoke-free parks policies, because it gives them a reason to go up to somebody if they are smoking, to talk with them. There might be issues about safety, crime prevention, gang activity in the parks. And so it's another way that the officers have of approaching people, talking with them, and figuring out what's going on. So they're actually quite in favor of smoke-free parks policies.
Interesting. Great. Well, if there are any other questions, please go ahead and submit them to the chat box. Otherwise, I want to reiterate what Robin said, that all of the information is going to be available on our website. You can download a recording of the webinar if there's anything you didn't quite catch and you want to listen again. And we've also developed an extensive list of resource materials. So a lot of the statistics that Robin mentioned earlier, she was just noting again the new data about the danger of exposure to secondhand smoke even in outdoor places and the amount of litter. We have information on that you can download. Additionally, there are a number of other states and communities that have done a lot of work on smoke-free parks, and so we're going to refer you to some of those resources as well. And then if you have particular questions related to your work in Cook County, you can contact Claudius Isfin, and his contact information is available on the screen. And then the folks at Cook County can kind of pool those questions, and if there's anything they want to pass on to us, they'll do that, and we can get back to you or to the county directly. So we had one other question that just came in, which is, has anyone used statistics on asthma as support for smoke-free parks? Robin or Nicole, do either of you have information on that?
I can say that for our campaigns in Santa Clara that we almost always use it in every one of our campaigns as a key message, because one of our core partners is First Five, so they often make that argument that if you have someone in the park that has asthma, this can trigger an asthma attack. And we found that to be very effective, and a very effective message, that it does have an immediate health impact, because that's often the argument, the opposition argument, as Robin mentioned, about the health effects in outdoor areas. But if you have someone who has asthma, there is an immediate health effect. So we use it a lot.
And I think one of the things that we've learned in California, and I'm sure this is true in other places, is that smoke-free parks or other recreational areas is a really good opportunity to bring in other non-traditional allies. So many of us are used to contacting the people who are professional tobacco control advocates, people who work, for example, for the Lung Association or the Cancer Society or other nonprofits that are devoted specifically to this. But smoke-free parks, and particularly some of the work that we've done on smoke-free beaches, is an opportunity to bring in people who are concerned about the environment more generally. The litter information is, as Robin said, horrifying. And so you can recruit environmental groups as advocates, other people who are concerned about kind of the public health and the environmental impact on beaches and parks, and just also the modeling issue, so people who are just concerned about what youth are exposed to. So you can recruit people who aren't necessarily part of your normal tobacco control coalition and use that as a way to broaden your base of support. All right, good. So also I'm going to put up the information. Our website is phlpnet.org. One technical note is that our website is undergoing some work, so it's going to be we're going to have a content freeze for the next couple weeks, and so we'll be able to send out the link to you for the website probably within the next 2 weeks, in addition to the resources. And so everyone who registered for this webinar, we have your information, and we'll be able to send that to you directly. Otherwise, again, I want to thank our speakers, Robin Salzberg and Nicole Cox, for sharing all the valuable information. And thank you to Charlene and Claudius from the Cook County Department of Public Health for asking us to do this webinar. And we're very happy to provide this information to you or provide any follow-up. So thanks again, everyone.
Ladies and gentlemen, that does conclude the webinar for today. We thank you for your participation and ask that you please disconnect your lines.